Okay, so we're going to talk about lower back pain a little bit more, and now we've talked about disc and we've talked about facet joint. We're going to talk about sacroiliac joint pain. Sacroiliac joint is the joint between the pelvis and it's in the pelvis, it's in the what's called the iliac and the sacrum. So it's right in here. It's a large joint surface, and it's really a common source of lower back pain. It'll hurt, getting up from a seated position. So if you're sitting for a while and you go to get up and it grabs, it could be SI joint pain. It could bother if you're doing a lot of walking, a lot of bending, a lot of twisting. And it's just because the joint is very likely out of balance or out of alignment. And so some common problems usually come from people sitting in bad chairs or in a bad position for extended periods of time. For example, let's say that you go home and you always sit on this side of the couch. And so your pelvis is kind of distorted as you sit there. You could be causing a low-level injury, low-level strain to that SI joint. There's a big fibrous capsule around it. You could be stretching it or distorting it. Some people have torque in their pelvis or rotation in their hips and pelvis, and that causes SI joint dysfunction. Leg length imbalances, leg length inadequacies can cause SI joint dysfunction. Traumatic injuries, weightlifting, speed-related injuries, all these things can also cause trauma to the SI joints. So what we try to do with SI joint is first figure out if that's the problem. So a couple of tests that we'll do is when a person is standing, we'll ask them to lift a leg. So in this case, if we have the person lift their left leg, then we're going to see changes in the pelvis rotation. And that's also because the muscles that stabilize the pelvis are not doing their job, and so we're seeing some SI joint dysfunction. It's really, really common, especially with athletes. So in most cases, this can be resolved with conservative care, and in fact, there's really no good surgical care for SI joint dysfunction. The ones that I have seen over the years have been really bad, where they just don't solve any problems, and the only real thing to do is really to fuse it, or sometimes they do injections, but it's not super effective. So the best thing to do would be get healthy muscle function, get back to normalizing all the muscles, tendons, ligaments, and everything in there in terms of exercise, the proper exercises. If you're torqued, then you'll have somebody analyze that, and they'll be able to tell you what exercises are good, what exercises are bad. Again, there's no one-size-fits-all exercises. There's no one thing that fixes everybody. There's no miracle solution. There's no magic stretches that fix all these issues, because there are just so many issues. So SI joint dysfunction is very common. And SI joints can sometimes refer pain down the side of the leg to the side of the knee. And sometimes that's confusing because that's kind of the same place that sciatic will go. I've had patients who have their only symptom of sacroiliac dysfunction is that their knee aches, or the side of their leg is numb. And that's actually the SI joint, and that's the referral pattern. It's kind of an interesting thing neurologically, but it can get confused all the time with sciatica. So it's complicated, and we just try to pull it apart and really understand exactly what the source of the pain is first before we try to treat it, because you could be wrong. I mean, and that happens all the time. Not just myself, but other people have commented. There's so many different sources of what could be causing the pain. It's kind of like whack-a-mole. Like, is it this? Is it that? Is it this? So part of this whole thing is the SI joint. And so we need to understand it. We need to be able to identify it when we see it, and we have to know how to effectively treat it. Okay? Thanks.